Good morning, everybody, and welcome to Greenham Trust Community Forum, one of many. I've forgotten how many we've done now, actually. It's interesting, we're at our 59th team meeting today of the Greenham Trust team, and probably our last one, actually, as well. I think we've finally decided we've done enough virtual meetings, but I think the community forums have proved to be very, very successful over the last sort of 12 to 18 months. And we thought this one in particular was a good one to promote, which is really mental health coming out of COVID. And obviously with all the media reports going on, of course, are we really coming out of it? We don't quite know what's going to happen over the next few days and the next couple of weeks leading up to the 21st of June, but all hopeful, of course, that things are continually and gradually improving. But clearly, as we know from previous discussions and earlier forums, mental health is very, very high on the agenda. So very, very big welcome and thank you for joining us this morning. It's going to be a very different session to the ones we've had before, which have been pretty much set piece. So please bear with us in this one. It's far more dynamic. We've got a number of speakers assembled here this morning. So just to run through them very quickly, you'll see their names on the screen. So we've got Dr. Heather Howells, who's Senior Partner at Kemp and Woolton Hill Surgery and the GP Clinical Lead for Mental Health Dementia at Berkshire West CCG. We've got Matt Pearce, who's Service Director for Communities and Wellbeing at West Berkshire Council, Grace Green, who's Director of Home Start West Berkshire, Laura Hunter, who's Head of Operations at Flag DV, and last but not least, Vicky Rowland, who's Dementia Coordinator at Age UK Berkshire. So a great little group. The aim is to, we'll have some set piece questions, as I said, but also is to have a discussion around the group, and hopefully this will prove to be very informative for all of you who are listening in this morning. So thank you again for joining us. I thought I'd kick off really. I think the big one for me to the whole panel is, the roadmap is opening up, we believe anyway, or not, as the case may be, bearing in mind sort of media reports. But we see that we are on a sort of progressive continuation now to some higher degree of relaxation. Can you just give us, as a view, as a panel, as we go around the panel really, what mental health issues you are seeing from the people you're in touch with, and how they've changed, and perhaps how you see them likely to change over the next few weeks and months. So perhaps, Heather, perhaps if I could address that to you first. Sorry to put you on the spot first.
No, that's fine.
I think somebody.
Thanks, Chris. I think we're seeing a significant increase in mental health issues all across the board, really. And I think as we come out of lockdown and the restrictions ease, some of those mental health issues are about worries about, is it safe to access services and the services that are being provided? Is it okay for me to be doing that? And worries around that. I think what we're also seeing a lot of is that unmet need, things that built up and people didn't want to come necessarily and see us before, or didn't know how to do that before, and have held on to things for a while and then have come at a later stage. So particularly around things like dementia, they're often coming at a later stage, and we're not unfortunately diagnosing as early as we should be, and that there are issues that come with that in terms of the need for carer support and how people have really struggled. I think from my point of view in primary care, I'm also increasingly concerned about our young parents. They've had a very difficult time, I think, during COVID. Being a mum or a new parent, mum or dad, is difficult at a time when you have support, let alone at a time when you're very isolated and lonely. And those services that have often kept us well and happy as young parents and new parents have not been open, or parents have not been able to access them, or perhaps they're only doing that remotely. So I think, I would say in summary that across the board in mental health, we're seeing a significant increase in demand and need for services and support.
Great, thank you very much. So you raised some interesting topics there, which I can actually address to other members of the panel later in terms of some of the details. So thank you, Heather. Perhaps if I go to you, Matt, next for your sort of comments on the same question.
Yeah, thanks, Chris. Similar to what Heather is saying, really. I think there's clearly quite a profound impact on people's mental health and well-being during the number of lockdowns that we've had, isolation, anxiety, worries, I think, and particularly you can look at the life course, I guess, and their different challenges for different ages. So older people in particular, they might be worried in terms of obviously just staying at home, but particularly as things start to open up, I'm hearing some initial concerns around people being anxious of getting out and about and mixing again, and actually what risks that might pose to them. But we obviously recognise that social contact is really important, particularly for older people, but also for younger people as well. I think there's other things we're hearing about as well, potentially in terms of job security. And obviously, furlough is due to end towards the end of this year, and what challenges that might present. So I think we possibly haven't seen all the impact of the pandemic manifest itself yet. And I think although we are possibly seeing demand in services rise, I think there probably will be more challenges going forward. I think there have been some opportunities as well, though. I think people have often talked about how people have managed to get out and about and, connect with nature, go for walks, to use those small amounts of physical activity opportunities they had to improve their mental health. So I think there are some challenges, but there's also some opportunities as well. I think within the pandemic, particularly, families have struggled with younger children and not being able to get out and about. I can imagine that's been quite difficult. So I think if we probably looked across the life course, I think we could probably look at different ages and different opportunities and different challenges, and they will vary between them all going forward, I think. But I think certainly as time goes by, we'll start to see a lot more indication in terms of the true impact of mental health in terms of what COVID has presented itself.
Yeah, very true. I think, it will only emerge, won't it, as we get through the next few months, really. The picture at the moment, I'm sure, is far from clear because it's just developing all the time, isn't it? Thank you, Matt. Again, some interesting pointers you raised there, again, which I can perhaps use with other members of the panel later. Grace, perhaps if I could address the same question to you, please.
Yeah, so young families have been mentioned. And it has been particularly hard on them, particularly new parents. We get a lot of reassurance from other people when we become parents. Those baby groups that we go to are actually really so important for our mental health because they reassure us that, yes, we are doing okay. Yes, our baby is okay. The things that they're doing and experiencing are very normal. So not having had that support during that time, I think it'll be interesting to see what the impact of that has been. I'm sure there's going to be an increase in anxiety amongst new mums. And certainly we run a perinatal mental health group, and we continue to run that throughout the pandemic. And what we found is that, a lot of our new mums really have been grieving for their maternity, and they haven't had what they planned with their babies. They were hoping they were going to get out, meet other people and do all these fun things, and they haven't been able to do them. And now that time is gone and it's been lost, and I think that's had a huge impact. They've talked about it as a real sort of grieving process that's been so difficult. And just having little ones at home, trying to do all the other things that you would do, homeschooling and all of those things, as well as trying to keep on top of their own mental health. I think the long-term impact of that will be really interesting to see going forward.
Yeah, it will be as it develops, as we talked about earlier. Thank you very much. So maybe, Vicky, if I turn to you now on the same question as we come out of the restrictions, again, what do you experience, or what your experience and what you expect to see happening?
Thank you. I think Heather touched on people living with dementia, but as she mentioned, it's been an extremely challenging time for both people living with dementia and also for their carers. So people living with dementia have experienced a faster rate of cognitive decline. So particularly exacerbated by isolation, by lack of routine. There's been lots of reports, and we've had lots of phone calls in about low mood, lack of exercise leading to kind of deconditioning. So they're definitely weaker than they used to be, less able to do things that they used to. And also for carers, just a particularly stressful time. So stress and anxiety, not only around the virus and the kind of impact of the virus on both themselves and their loved ones, but also almost a grieving process of the loss of their loved one, because the symptoms of their dementia have been sped up due to the things that I mentioned earlier. A lack of respite for them, so they are with that person living with dementia if they're in the same home 24/7, which can obviously be really stressful when there's nowhere for them to go. Have a bit of downtime, and also the loneliness and isolation for both parties that kind of brings with those lockdown periods. So where they might have had help or support from other family members, obviously that wasn't able to happen. Coming out of COVID, definitely the mental health issues that we're seeing are related to that isolation and loneliness. They are, both carers and people living with dementia, less resilient to stress. So things that they would have been able to deal with quite easily previously actually become crisis, because their stress levels are through the roof. We've had a lot of quite complete carer breakdown, which has obviously been really difficult. And we're definitely seeing at Age UK Berkshire not only an increase in demand for services, but also an increase in demand for advice about who they turn to, about who they can speak to. Because, as Heather touched on, people's cognitive decline has gone so quickly that actually things that they needed to ask a year ago are so different from what they need now, and they need information and they need it quickly. So very much the kind of thought process of us is that we will keep offering kind of an online and a face-to-face blended offer. So the kind of the demand for our online services is still ginormous, and I'm sure we'll talk about that later. But as we come out, we're trying to offer as much face-to-face as we can, not only to provide carer respite, but to get people living with dementia back out into the community, to boost that mood and to boost that kind of mental health, the problems that they've been facing. So yeah, that's kind of where we are at the moment.
Very useful indeed. We'll come on to that point as well about the face-to-face versus online, and how do we take that one forward. So thank you, Vicky. Laura, sorry to leave you till last in this, but same question to you.
Yeah. So the issue with domestic abuse is that you're looking at a particular issue that obviously was existing before the pandemic. And what the pandemic has done is it's compounded some of those issues and just added fuel to a fire that was already burning. You have people who were not only having to deal with the abuse that was already happening, but then the stress of homeschooling, furlough, jobs being lost. And even in the initial stages of the pandemic, access to food was an issue. So you have all those things that sort of added fuel to an already very intense fire. So I think that one of the things that to be very mindful of is that those stresses that built up over time don't just go away as we come out of it. Where we did see numbers double last year compared to previous year, we're actually seeing already a 25% growth as we're moving further out of the pandemic, and an increase in the amount of people who are trying to access support and need even more additional support, specifically around mental health. And so I think that it's one of those things where, as people were already dealing with abuse or whatever those issues were, they now have the issue of trying to understand, well, what can I do? What can't I do? And it just sort of compounds problems that were already complicated in the first place. So I think that we're trying to look at, creating more, even within ourselves, a more inclusive level of support to try to help people, know where to reach out for support and know how to access those different levels of support.
Indeed, yeah, and that's very, very important, isn't it? Is how you reach out for that support, in this sort of changed environment. So thank you all for that. It's very useful. There's lots of pointers there which I've scribbled down, so I'll look to address some of that, to some of you specifically as we go through. But I think the one that Vicky brought up with this whole thing about the virtual stroke sort of being back in the real world, and I thought that was actually something quite useful for us to explore as a group. Really, is how do we see ourselves positioning ourselves in terms of how we go about doing what we normally do, whether you're a GP as Heather is, or whether you're sort of providing services that Grace does, how do we see that sort of the mix between the two? So if I could address that, please, to Laura, I'll come straight to you on that one first, please, because you waited last time.
I think the pandemic was sort of an interesting social experiment. If you consider, take yourself out of the emotion of it, you saw organizations and groups, testing the waters to a different level of accessing support that maybe they never would have done had the pandemic not existed. And one of the things that does create is it creates a much more well-rounded access point for people. There might have been people for us, somebody coming to a face-to-face clinic, they would have to take, hours off for work, where now they can sort of sneak in a 30-minute phone call, as and when. So it has created this incredible breadth of support that we maybe never would have looked at. It probably cost everyone in time and money and effort to figure out how you do this, how you give the support virtually. So I think that's an amazing tool, but it's really important that we now look at a blended understanding, look at the lessons we've learned from the pandemic and how we've been able to offer support, but then also look at pre-COVID lessons and where we were able to meet people, because, as we move forward out of this roadmap, we do need to reflectively look back and think of who maybe wasn't able to access support because of the limitations of not having access to digital technology. So it really is important that we sort of look at both of them and not, it's an opportunity, isn't it? It's an opportunity to grow your service and strengthen it.
Yeah, I agree. It is. I think the blended approach, I think that will be a common theme. But again, one of the significant challenges is access, isn't it? Because as we know, not everybody has access. Can I invite a comment from somebody else in the panel to that, in terms of their views? Vicky?
So for us, we will very much be focusing on a blended offer going forward. I wrote a dementia strategy for Age UK about 6 or 8 weeks ago now, and it was very much a key kind of point in the strategy that actually we have reached people by offering online services that perhaps we wouldn't have actually reached before. I've got a number of people who come to the Dementia Cafe that we organise, for example, where their loved one is actually unable to speak but is very able to sit there and listen. So they probably wouldn't have come and accessed a face-to-face Dementia Cafe, but actually we have a live performer, we have poetry and short stories, and they will sit there and listen, and their carer has reported that they absolutely love the music. They'll happily sit there, they've got a smile on their face. So actually we are reaching people that we wouldn't have done before. And I'd say with the blended offer as well that actually we people I think are more able and more have more ability, I'd say, than we give them credit for. I think before I joined Age UK, there was very much a view that perhaps people with dementia wouldn't access an online service. I had 60 people on a Dementia Cafe online last month. So that's very much a view, I think, that has changed. I think people have become more able. They have reached out to friends and family for help. They've reached out to us for help, so we will give them help accessing Zoom or accessing technology to be able to kind of interact with people. So yes, there's definitely a demand, particularly at the moment, for face-to-face services, but I know that we will continue those services and almost keep in the fold those people who aren't able to access face-to-face services. So yeah, it's been a really interesting learning curve, I think, more than anything else, about quite how resilient people are and how adaptable they actually have been, whereas maybe previously people wouldn't have thought that would be the case.
Yeah, I think you're right, actually. If it'd taken us back to, sort of 15 months ago, I didn't think anybody quite believed we'd sort of be online to the degree we have been, but people have embraced it, and I think it's good. And obviously, as younger generations come through that are more computer literate, that has to help as well, doesn't it? Heather, if I can just suggest something to you, in the more sort of formal sort of setting of a doctor, and the sort of advice and the help you give, do you see yourselves also doing this sort of blended approach as well, or will you transition perhaps more face-to-face? I mean, how do you see it impacting what you do?
I think it's a huge challenge in general practice, I have to say. So our service completely changed overnight to an online and telephone service. And I think a blended approach will be where we go or head towards moving forward, but with the need to ensure that we offer face-to-face services to those that want it and need it. I think, like Laura says, there is no doubt that there are some people that want to access their GP services whilst they're still at work and their kids are still at school, and a phone call or a video or sending a photo is actually much easier and has actually increased their ability to access our services. But I think that sometimes much of my work is easier if I can eyeball someone and sit and have a chat with them face to face and make sure they're well. That's a huge part of what I do. And I think if we're looking at the groups that we have around us, I think sometimes, for example, people with who are suffering with domestic violence actually probably can't talk to me on the phone. I don't know who else is in the room there with them, and I have to ensure that I'm doing that in a safe way and that they can talk freely and safely. So sometimes them coming in and having an appointment where I make sure they're on their own without anybody else and free to talk is vital. So I think for general practice, the challenge is huge. I think the other thing, as you mentioned right at the beginning, is the uncertainty about where we are with the Delta variant and everything else that's going on. We don't want to rapidly open our services and then have to reduce them down again. And I think the other big challenge for general practice is that a large part of our role and our extended team's role is signposting to the other wonderful organisations we've got in front of us. So understanding how their services are operating is key to us. So their blended approach and the knowledge of where I direct my patients to is going to be important.
Yeah, indeed. Thank you very much. That's very, very clear as well. So you mentioned about eyeballing and the importance of eyeballing patients. And I think this is important for all of us as human beings, isn't it? Because, you know, body language forms such an important part of the key messages we get across from people. We just don't get that, you know, across a flat screen, a two-dimensional screen. You know, and I found that as I'm out and about now, meeting more people, you know, it's great just to sort of get that interaction. And also some of the more sort of difficult things we have to deal with. And obviously, many of you deal with very difficult issues, really. You know, I get away lightly with all that. You know, it's often good to meet people face to face, isn't it? Grace, perhaps if I address it to you, really, and then how you see this sort of going forward in terms of the sort of blended approach and the need to actually get physically with families and see how they're dealing with the problems they're facing.
Yeah, we've certainly seen some benefits in kind of our organisational processes and procedures, team meetings online and stuff like that. But actually, the family work that we do, I don't think we'll ever really move towards a real blended approach. I think we'll always want to do face-to-face. It's very difficult to engage children in this kind of platform. If you've got a parent with a child with a baby, you know, to try and do some of that work, it just doesn't work over Zoom. And we've had family groups where the mums are there with their children, and it's really a bit chaotic to be able to see what's really happening in the home. You don't really get a flavour. And I think as well, our volunteers, they get a really good understanding of what's happening for a family when they're going into the home. They're not seeing this little box with a person's face in the middle of it. They're getting the whole flavour of what's going on for that family. And I think if we went to more of a virtual type of support, I think we would lose that. I mean, it's been great to be able to keep in touch with families, but we found the best types of support that we've been able to offer during the pandemic have been standing on somebody's doorstep and having a conversation with them at a distance. And the walks, our families have really loved being outdoors and getting outdoors and seeing people face to face. And when we've been able to do that, you know, we've seen a huge upturn in their well-being as a result of just getting together with someone. I think that human contact is so important for mental health, and I think we'll always use that first and foremost at Home Start.
Yeah, I'm sure that's echoed, as we know already, by everybody else as well. Thank you, Grace. Matt, you know, from a sort of top-down approach, looking from a public health sort of overview, you know, how do you see this sort of panning out really in terms of the blended approach and this need for sort of physical interaction and people being able to eyeball one another, and how we deal with that as we face some of the difficulties coming out of the pandemic?
I think there's been some good points raised already around digital access. Digital literacy is another one. I know the NHS are quite keen on. So how do people have access? How do they actually utilise some of these digital technologies? The one that really interests me, actually, which I don't think we've touched on necessarily, is workplaces, and how it's been quite a difficult separation between work-life balance for many employees, because they're bombarded with countless Zoom meetings, MS Teams meetings, back to back. They don't necessarily have time to breathe sometimes and rest. And then sometimes there's not that divide now between evening work, because people are sending emails and Zooming at all sorts of meetings. And I just wonder what that impact might be on our mental health. And then also how we then transition to a blended hybrid approach for many workplaces that actually do a combination of both. And I know the council are one organisation that are looking at that, and I'm sure many other organisations are looking at that blended approach and the impacts of our mental health, how we do that. And like you say, Chris, not having that interaction in the office, in our workplaces, and it's going to be different for every different organisation, but I'll be really interested to see how that plays out. Clearly inequalities is going to be the focus, and we know that the impact of COVID is disproportionately impacted different individuals, and that's not going to be any different to mental health. So, you know, and I was really interested to hear what Laura said around we didn't start with no mental health issues at the beginning of this pandemic. We have to remember that, don't we? We've actually, you know, there's already a lot of issues in the community. 1 in 4 adults experience a mental health issue every year, and already we're going to be struggling to keep on top of that going forward. So, yeah, it's quite a pessimistic point of view. So digressing a little bit, but I think a blended approach might work, but we really need to be careful about how we do that, and it's going to be very different for each individual and organisation, I suspect.
Yeah, so that's coming across as a very clear message, blended approach. Interesting you said that statistic about, you know, we didn't start, you know, the pandemic without any mental health issues. They were already a major issue, and perhaps one much overlooked, and perhaps the pandemic, as in many other things, it's helped raise it up the agenda, hasn't it? But you said 1 in 4 cases. Where would we think it would be now? Perhaps you make a comment on that, or perhaps Heather. Is it 1 in 3? Where is it now, do we think?
I'm quite happy to come back. I think it's too early to tell, Chris. I think we're starting to get that. We're starting to get that information. I think there's, Heather might have a on the ground, I guess, experience in terms of what throughput's coming through.
Just a bit of guidance, really.
Yeah, but like I said, I think children, schools, that's been difficult as well. I suspect demand's increasing in that age group as well. And I guess over time we'll start to see that data coming through, and the demand will reflect that. We know there's still that stigma associated with mental health, so people don't always come forward. So I guess we need to understand how we can identify and support individuals rather than just counting numbers, which is always quite tricky. But I'll defer to Heather; she might have some insight on the ground.
I don't know if I haven't got an exact figure, but I would say on a day-to-day basis, 50% of my consultations in practice involve some aspect of mental health. And that is probably more. And I think previously it was probably a third, but it's definitely increasing. And like Matt said at the very beginning, that encompasses all age groups. So we're seeing that, from new families and very young children all the way up to our patients with dementia and our elderly. So I think it's across the board, but I think it is too early to tell. I think you're right, and what the exact impact of that is. But I do think you're right that the silver lining of COVID is that it has highlighted those health inequalities and brought them to the fore. And actually, that can only be for the good, that we're focusing on them and we're doing something about them. I think that's the one thing we should hold on to.
I totally agree with that. Yeah. So it's interesting. So my perception was it's probably increased, and it sounds like also it's gone across the sort of age spectrum as well. Too. When we were doing the original run through, and this is why one of the reasons I picked up on it, anxiety was mentioned by I think at least three of the panel at that time, and then we've linked it to the workplace, and Matt, I think you brought that up as well. And it obviously, because of the sort of changing work patterns, people working from home, and again, there's been stuff in the media about companies signing up not to send people out of hours emails and all those sort of things, which put pressure on people to respond. And I was guilty as the next man, because I happen to be an early riser, so bang the emails up early. So I have to hold myself back. But do we see that being a significant issue in terms of taking it into the workplace now, and with people anxious about their jobs, perhaps coming out of furlough, is their job as secure as it might have been pre-pandemic? Again, are we seeing that being a key driver that influences everything really, whether it's young families, whether it's domestic violence? Perhaps Laurie, you might have a view on that and what you're seeing there, from driven by the workplace and pressures there.
I mean, I don't know. Personally, in our work, we don't really hear much about sort of the background with work and things like that. But one thing that specifically affects our demographic is, and it's related to other workplaces, is some of the delays that have happened. Like, for example, in the courts, family court was already sort of had issues sort of meeting the demand and keeping up with the demand before COVID. And then once restrictions were introduced into other work, it sort of created this backlog of access. For so many people are waiting up to a year, for their court cases. We had one gentleman sort of on the phone with us in tears saying it's been almost 2 years since he's seen his children. And he just felt like his voice wasn't being heard because, because of those delays. So I think that it can be an individual, stress point, of course, with people working from home and whatnot. But it's also important to recognize that some of those restrictions that happened also exacerbated other issues, as far as people accessing the support, because those organizations were maybe doing more virtual and whatnot, and created a bit of a backlog.
Yeah, good point on the court backlogs, of course, because they existed again pre-pandemic and probably have changed or got worse, haven't they? So, whereas I think we've talked about, and Heather picked up on this, mental health has raised up the agenda, and we're probably we're talking about it this morning, aren't we? But I think on the courts, they're really restricted, aren't they, in terms of how they can deliver that. So that is a long-term structural issue we're going to be facing in the UK. Any other comments about the workplace and how it sort of interweaves with what we do in our own sectors? Perhaps Vicky?
Yeah, I mean, specifically the kind of the demographic of people that we are kind of involved with are not typically working, although we have seen an increase in, due to carer stress, kind of daughters and sons and other relatives taking a more active role, I'd say, as we're coming out of lockdown, in helping to relieve some of that stress on their mum, dad, auntie, uncle, older relative. So in a lot of the services that we run, I'll now have a daughter or a son bringing somebody along, as opposed to mum or dad, just to give them a break or to give them a little bit of respite time. So obviously they're having to juggle that with work. So we're finding that if we're planning things further in advance, that people are able to kind of better juggle their diaries, if that makes sense. So perhaps that wouldn't have been an issue previously, because it would have been mum or dad or, a partner that would have brought somebody or made the time to bring someone. That's definitely been a difference that we've seen. With specifically regards to our workplace, we are definitely on a kind of blended approach. So we are one day in the office a week, all team members, very spaced apart over 3 floors, very skeleton staff, and then the rest of the time from home, which is, I think, both a good thing and a bad thing. As you said, I'm invariably on my emails at 7 o'clock in the morning or 7 o'clock at night, just not wanting to leave anybody without help or support. And I think specifically when you do a job, as all of us on the panel do, you're normally quite an empathetic person and not able, I would say, to leave your work at home. So I think that work-life balance is definitely something that I've noticed in my own kind of personal work field that has taken a bit of a battering, I would say. But I don't think you do a job like this if you're not wanting to kind of go over and above, I'd say. So yeah, but specifically we don't really deal a lot with people who are currently in work or currently employed. It's more younger people with dementia with a diagnosis under the age of 65, and we only deal with over 65s. So yeah.
Great. No, thank you for explaining that as well. Yeah, I think, the workplace and the pressures around that and working virtually are very, very obvious, aren't they? And I think it's a bit like technology as well, isn't it? Because, I remember going back to the days before we had a fax. You had 3 days to respond to a letter. The fax came, you had to respond pretty much. It was expected you did it in the day. And then we got the email. It's almost immediate, isn't it? And, our attention span has gone down and down and down. That has to have a massive negative impact, particularly on young people, and people who walk about with their phones all the time. And I'm guilty of that as well. So thank you all. I've had a question in from Joanne Stewart, which I'd like to address to the whole panel, if I may, actually. So I'll read it out as well. So this is from Joanne. She says, I've had local friends and family members talk of a sense of guilt almost when they go out and about and try to get back to normality. I think this is a common theme, isn't it? But such a long period of lockdowns and restrictions, and perhaps others judging when they see people out and about, has led them to question whether it's okay to be out socialising and meeting friends or going away, for example. What can we do to help and encourage people get out meeting others to boost their mental health in a safe way and get back to normal? Matt, could I address that to you first, please?
Yeah, thanks, Chris. Yeah, it's a really good question, actually, isn't it? Because I think for so long we've been telling people to stay at home, don't socialise, don't mix, for the very reason of preventing COVID infecting others. So I think it's that kind of nuanced messaging, isn't it, where we want to actively encourage people to get out and about, particularly engage with nature, as I spoke to earlier. And obviously the government rules constantly change, which I think always cause a lot of problems. I've had that in public health, trying to communicate the constant changes to government guidance about what people can and can't do. And yeah, I can see how some people might feel stigmatized for going out and being worried what people might think. But I think it is important, like Joanna said, around encouraging people to socialise, but doing it safely. We don't want parties of 100 gathering and things like that. It has to be done in a safe way. So it is about the messaging, isn't it, I think, and how we do that with all our organisations, and maybe selling the benefits of actually socialising is important to us. It's part of who we are as humans, our nature. So I don't have a clear answer, if I'm honest, but I think there's something like maybe we can take away as a local authority about how we encourage people to do that, but in a safe way, and maybe, like I said, communicating the guidance to inform people what they can and can't do. So yeah, it's a difficult one. I must admit that one. I'm not sure if anyone else has any insight.
It is a difficult one. I'll address it to others as well in a minute, but I think it is, because one person's safe, is another person's very unsafe, isn't it? It's back to the whole hugging thing. We've had people around in the garden, some who are quite happy hugging, some are people who are keeping a distance. I'm quite happy to keep a distance personally, but it's different. It's a whole perception. Do you go on holiday or not, isn't it? But Grace, perhaps you from a sort of young family's point of view, how do you see this one working in with that and answering Joanne's question?
Yeah, I think it's recognising people's starting points. It's such a personal thing for people to how they feel about the virus now, how they, how anxious they are, what they would feel as normal in terms of how much they would socialise. And many of the families that we supported originally started really struggled with socialising with other parents, and that's why we worked to have groups that made them feel really welcome and were very nurturing, so that they found those situations a little bit easier. Now we're back running our groups again, but there's a real reticence from some of our families about getting back together, and that's partly based on social anxiety, which they would already have had, but also on the fear of the virus. And I think, it's very difficult, isn't it, when you hear of Delta variants, and, I think people do get scared that, oh, here we go again, we're going to be in exactly the same position again. So I think it's about just reassuring parents that we are here for them in the capacity that they feel able to cope with. So, if a group feels too much, that just a one-to-one with a volunteer, there's options for them to be able to get out and socialise and have some of those conversations that they know are good for their well-being, but at the same time keeping them safe and keeping the volunteers safe and keeping the families safe, and how we go about that. And certainly we look at it in a kind of risk assessment way and risk assess each family and each volunteer in each situation. So, just making them aware that we are thinking about all of those things when we're supporting them. But yes, I think, as Matt said, it's recognising that those interactions are so important to us, and they're so good for our mental health, that we need to incorporate them in a way back into our world, that where people feel comfortable that they're giving as much or as little as they want to.
Great, thank you. Yeah, I think it is important that interaction is clearly critical, but people want to go at their own pace, don't they? And I think, even this morning, watching breakfast TV, sort of conflicting messages coming out from Manchester, isn't there? Andy Burnham saying, you don't travel to that area outside where you are. If you are meeting people, do it with a social distance, and you're getting conflicting stories from other people as well. So it is very tough out there, what is right, because people will take a very different view on that. So I think, Matt, you're right to say about the messaging. Is that a sort of collective view, do we think? We need to make sure we've got some very clear messaging out there in terms of how people should look to try and behave as we sort of emerge out of the next few months.
Yeah, I think so. And I think Grace made a point. It's just people understanding, isn't it, that people feel differently about this. Everything we've been doing throughout the pandemic is understanding risk. And risk means different things to different people. And that's literally every day. My role in leading on the COVID pandemic is about how we understand that level of risk, individual risk, collective risk. So I think it's just recognising that people do need to go at their own pace, as Grace said, to communicate that government guidance and just be aware of how people are feeling. And understanding that some people might be anxious, others they do need to socialise at their own pace. So yeah, I mean, again, that's something I'm sure the council can take away and share those messages, which hopefully our partners can share, so we get a kind of a clear agreement in terms of the consistency in the messaging going out.
And I think you're right, yeah, and that would be great if you could actually. And what this is highlighting to me actually is the benefit of having a more sort of free-flowing sort of discussion this morning actually, because I'm learning a lot more this morning than I've learned in others, which have been sort of more presentational based. And I think these groups, although they might have to be sort of virtual for the time being, although perhaps increasingly they don't have to be, it's great intelligence we're gathering, isn't it? I've got another really good question actually from Kelvin Hughes from the Newbury Community Resource Centre. So Kelvin is saying that given that there appears to be some agreement that COVID is here to stay at some level, should we also be looking at how we adapt to living with COVID in the longer term, rather than largely focusing on dealing with it as a timeline consisting of a beginning, a middle and an end, which we do seem to be focusing on, and politicians are taking us down that route. So Kelvin, I thank you very much for that question, because it's very, very appropriate, because I think we're in this for the long term. Perhaps from Flag DV's point of view, perhaps Laura first, you could give a view on that.
I think that goes back to that focusing on creating a blended space. So COVID is obviously a little bit more long term, because it's not just the effects of COVID and maybe the social distancing, but also the attitudes in society. I think some of those attitudes are here to stay. Some of those sort of anxieties about large spaces or large groups. So I think it is focusing on what lessons can we learn from what lessons can we learn during, and that is the approach that we take throughout. Even beyond this, and I say beyond this not as in leaving the pandemic, but as in life outside of us thinking about, okay, what can and what can't we do? This is now the normal, and getting used to what that normal looks like is going to be different for every organization. Like Grace sort of said, they need to look at more sort of almost, dare I say it, pre-pandemic, reflections, but they would obviously have the lessons that they've learned as far as. So, I mean, for us, we're looking at maybe, finding more ways to, approach people and where they are comfortable with, whether it is partnering with other organizations to offer support within, a safe environment in their location, or whether it is continuing to offer virtual support. I think that, one of the interesting things for us, at least, is that the pandemic sort of created a little bit more. We were talking about the lack of boundaries that people have, and that can be a problem, but it also opened up the door to people's understanding of what they can and can't do. For example, our solicitors have found themselves a little bit more open to having more ad hoc times and meeting, some clients, they would say, well, I can only call you at 6 p.m. That's my only time frame. And that has sort of opened our eyes to the fact that we can adapt and change, and it's not as scary as it maybe would have seemed. So I think it's both, it can be maybe intimidating, but it's also quite exciting at what this world is going to look like outside of us, thinking about this as a pandemic, but more as life going forward.
Yeah, it is preparing for a completely different normal, isn't it, as we did touch on right at the outset. And again, thank you, Laura. So Vicky, from your perspective, you've got your hand up actually, so I was coming to you anyway, so well timed.
I was just going to kind of echo what Laura had said, that I think for us it's going to be very much about listening to how our service users are feeling, and there is such a wide spectrum of how they're feeling at the moment, and also for us being quite nimble with our response to that, so adapting services to suit their needs. So for example, pre-pandemic everybody probably would have just got up and gone for a walk. Post-pandemic, lots of people with dementia and their carers don't actually feel comfortable doing that. So we've been delivering a service of outside walks for people with dementia, which are fully booked every week, because people just want that extra safety and security. I've done a risk assessment. There's somebody there, that's somebody that knows the location. They're walking in a group of people, so they're also getting social interaction. They know that it's socially distanced. Whereas before, they probably would have gone to that very same park and walked with their very same person. Now doing it as part of a group, it feels safer somehow for them. And I think there's lots of examples of that, particularly across West Berkshire, actually, where people are being very nimble outside dementia cafes, coffee mornings, but they're taking place outside, so people feel a bit safer. So it's almost like that halfway house. And again, it's that very kind of blended offer and that blended model. So there is an online offer for somebody who wants to go to a cafe, but actually now there's an outdoor offer for somebody who wants to go to a cafe. Come the middle of July, I will be running inside offer for people who want to go for a cafe. But we're listening to that feedback from service users and understanding that everybody's requirements are quite different, and the level of kind of safety or how confident they feel will be quite different. So I think it's just about being nimble and adapting those services to suit people's needs at the time.
Indeed.
And
so
who knows what that will look like long term. Again, I think the blended offer is the way forward, but things can change, as we are now well aware. And I think it's about that kind of reacting, that speed of reaction of kind of, are we providing the services that people want to access, and making sure that we are. Yeah.
Thank you. So yes, the blended approach is coming across loud and clear this morning as well. And I think what also comes across to me is innovation as well, in terms of what you do and what Grace has been doing. And again, it highlights to me the real benefit of these little sessions, really, whether it's a small group like today, obviously with an audience around us, or whether it's in a set focus groups as well, isn't it? Because what we don't want to do is lose any of this. And stop innovating as things develop. And as Kelvin says, don't look at it as a beginning, middle and end. Let's look at it as ongoing. Where will we be And I'll finish off today and where we expect to be in 12 months' time. That'll be my final question, just so you can get your heads around that for a few minutes' time. But we'll do that as well. We've got another question in, so thank you very much, Vicky. We've got another question in. This one is from Sarah Slack. So Sarah said, how effective was the ANI initiative during the lockdown, and will it continue, please? I have to admit, I knew nothing whatsoever about what ANI meant, actually, but it's been researched for me, so I've got a research team behind me. It's a bit like BBC, isn't it? So apparently ANI is a code word scheme in pharmacists for those suffering from domestic abuse, apparently. I'm sure Heather will sort of know about that, and so will Laura, perhaps. So Heather, perhaps I could address that one to you first. You know, how successful was the ANI scheme, if we're able to talk about that, please?
I guess Laura might be better than I am at answering. Right. I think it's something that's come out to us, that we're aware that there are code words that people use, so that if we hear them, we think, oh, actually, okay, you know, I need to help this person, and this person may not be safe to help right now in this way that we're talking to them. So I think it was about kind of publicising that domestic abuse was on the rise and that people needed help and how to access that help in a remote way. But Laura, you'll probably be able to answer it better than me.
Sorry, Heather, to put you on the spot. No. Sorry, Laura, over to you, the expert.
So it's in a way, it's sort of we have had people use it. And so we have actually had clients able to have their appointment in the safe space of a pharmacy. One of the problems you have with big programs and schemes like this is, of course, if there's large publicizing of this, then of course it twigs it to the perpetrators. So if they do hear, you know, somebody use these code words, well, then they now know what those code words are. So it's quite a double-edged sword where we're trying very hard to be innovative and create safe spaces where maybe possibly one doesn't exist. But it is a fine balance as to how do you create this awareness of something like this without then also adding to the danger that a victim might, you know. So and it only came into play in January of this year. And so it hasn't really, maybe we haven't seen it, you know, grow in its use, but we have actually had a few clients use it. So I know that it is being used to a certain degree, but whether it's being used very widely and as to why, I'm not sure.
Great. Well, thank you very much for clearing that up, both Laura and Heather as well. So, Sarah, I hope that answered your question. Sounds like it has been effective, but you know, we don't know how much, but certainly it's probably better than nothing at all, isn't it? But you're right. If you publicise it, then it ceases to become a code, doesn't it? At all in that regard. One of the things I've got a couple of things I'd like to touch on as we sort of get to our sort of final 10 minutes of the session this morning. Really, is one of them was one will be looking forward, the other one's looking back. And just in a personal view from people around the panel, really, and I'll go around the whole panel on this one, if I may, is, you know, what personal lessons have you learnt over the last 12 months in terms of how you operate as an individual, how you operate as an organisation, and how you'll tailor that going forward? So perhaps if I could ask that to you, Grace, first.
Sorry, I'm on mute.
Yeah, don't worry. You're not the first one to do
that. Personally, I have found that I've been a little bit kinder to myself in the end, after probably being a little bit harsh and trying to do everything. There's somebody else said about being in an empathetic kind of role. You want to take everything on, and I think at the beginning of the pandemic we definitely did that. You know, we were all things to our families, and I think that was quite hard on myself and on the staff team as well. So it was recognising that I really wanted to make sure that my staff were also taking care of themselves, and I couldn't do that without saying, look, I'm doing this as well, because this is how we model. We model them taking care of it themselves, so that's really important. Going forward, we've reflected as an organisation on how, on some of the positives that have come out of the pandemic, and what's been good over the last year, which has been, you know, a lot of our team have found it great that they can adapt their hours to working more flexibly, which has been great to work around their families, working from home, but having some time when they can come into the office and perhaps work in the office. So it's been giving them that space really to find out what works for them, and making sure that they're considering their own well-being as well, and how that impacts their work.
So not only kinder to yourself, but kinder to the people you work around and the people you work with as well, which is great.
Yeah.
Thank you. Yeah, which I think is very appropriate. Yeah. Heather, your personal sort of learnings from the last 12 months or so.
I guess from a professional point of view in general practice, I guess what I've learned most is that we have the ability to change. I think general practice sometimes got stuck in the 19th century, and, you know, it actually forced us to use technology that we knew was available, but we didn't like to change. And the other thing that I think I've learned is collaborative working is hugely important. So particularly in the vaccines, as a group of practices in Newbury, we came together to deliver that, and that has worked so well. And the ability to provide a service for our patients across a group has been amazing, and reminded me that we need to continue not to work in our silos, and that actually goes across all of the organisations that are here today. For example, you know, we need that joint working is hugely important, and I think COVID has brought that to the forefront and brought us together, and that needs to continue. I think, as Grace said, it's been hugely challenging, and I have been worried about the staff that I work with and their mental well-being, and the need to focus on mental well-being has been huge. And so as a practice and organisation moving forward, that's a huge part of what we'll do, which we didn't used to do before necessarily very well. So that need to ensure that people have a break during the day, that they go out for a walk, that experience nature, and that it's all right to say when you're not all right, and that we will listen and make changes. So I think COVID has for us highlighted the need to do that, and that's a positive thing.
I think it is, and that links back to the sort of kinder to yourself and kinder to the people you work around, isn't it? It's being more aware really of other people's needs. You know, thank you very much for that. Certainly, Vicky, can I have your view, please?
So I think from a kind of Age UK kind of Berkshire perspective, it's definitely about the benefit we felt of being a local service, because I think a lot of the kind of more national charities are obviously taking a more national view, but actually with being a local service, we're very much in touch with local people in and across Berkshire. And I think that's been really, really helpful throughout the pandemic, because it gives us more scope to be able to listen to people and to be able to be more flexible, as I talked about, and to be able to be more innovative to help that specific group of people rather than looking at things from a national piece. So I'd say that has definitely been a positive to come out of it, and I've definitely noted that as a positive. I'd say, as a couple of the other ladies have touched on, that we have not only pulled together as a team, so internally people helping out people, dealing in functions maybe that they wouldn't have dealt with before, but also externally with other organisations, and making sure that we're kind of galvanising people's strengths and weaknesses, pulling together and really making things better for people. And also what I've really noticed, and what has been probably my biggest learning with an Age UK Berkshire perspective, is the desire for people to help. The number of people that we have that want to volunteer, to give up their time, to help, to change, to call people, to be part of a buddy system, or to help to run an online cafe is just astounding. And, you know, I think the kind of call to action has definitely been received loud and clear by people across Berkshire, and particularly in West Berkshire. You know, some areas in West Berkshire have just gone above and beyond for people that they support, and Pangbourne being one of them. And I just think that kind of desire to help has been astounding to me. On a personal level, you know, having joined the charity at the end of last year, our CEO is fantastically supportive and really, really encourages flexible working, whether that's flexing hours or working from the office or at home. So I think that's been absolutely brilliant, and I think that's across the board. She supports that. And also, probably from a personal perspective, my ability to multitask is perhaps better than I thought it was, juggling homeschool and another childcare and a husband working from home, which comes with its own difficulties, the extra plates and things. I think I've probably do myself a discredit, because actually it's been a tricky time for everybody, but I think perhaps we've all dealt with more than we thought we would be, and I think have dealt with and have multitasked slightly better than we thought we maybe would have done if somebody had said 18 months ago this is what would have happened. So yeah,
I totally agree. No, thank you very much. Yeah, totally. Laura, your take on this, your learnings.
I think you know, there's obviously been several key learnings that are in in conjunction with what Grace, Victoria, and Dr. Howells said. But I think one of the things too is being more purposeful with action. So it's very easy to sort of get into the routine of life and get into the routine of your job. But I found that as the pandemic presented different problems, it gave more pause for reflection. Well, why are we taking this? What is the purpose of this? Where will this take us in a week, in 10 weeks and whatnot? And being a little bit more purposeful, because at the end of the day, we can't be all things for all people. And I think that's one of the things that, is both a personal and a professional, and we were sort of put in the position of having to be all things for all people, but actually no one can do that very efficiently, especially in a long stretch of time. So just being very purposeful with both my individual actions as well as the charity's actions, and making sure that we're not trying to stretch ourselves too thin, that we do strengthen our core offering, and that we do make sure that we are meeting people where they're needing to be met, and that we're not sort of overstretching ourselves to the point that we're offering the world and we can't provide it. So I think just making sure that we're being more, I'm being a lot more reflective lately. I find that my conversations tend to be, thinking a little bit more outside of the box, and I've appreciated that sort of reflective time, both personally and professionally.
That's an interesting point on reflection, actually, because it's not something it's one of my key strengths, but it's something, I found I've been able to do more during this sort of, working from home, because you do get down times, and just reflecting on, how things went, did that go well? Did it go badly? Would you have done it differently? Let's think about this problem. I think that reflection, perhaps time for that, is very, very important, actually, that we don't actually didn't make time for before. So thank you very much, Laura, for that. Matt, last but not least, before I come on to my final question, your learnings for the last 12 months must be many, I'm sure.
Yeah, it's a difficult one. I mean,
sure it is for you,
at a personal level, I think I find it really, really difficult in public health for obvious reasons. I think working incredibly long hours, managing homeschooling like everyone else, I'd imagine, on that front, and it has been difficult, and I have tried to do that reflection. And I think going forward for me is I have talked about work-life balance, and that is probably a personal something I personally need to improve on, I think, as well. I think what everyone else said around community resilience, Chris, I know you and I have talked about this a lot. I've been really taken back by how our communities have come together, not just the voluntary sector, but all the organisations, how we all rally behind and support those that are, need support at that time over the last 15 months or so. And that's something I really want to build on. I know you do, Chris, as well as probably many of our colleagues on the panel, is how we build on that. And it is like, what is the good things that we can take away from the pandemic? And there are some good things, there are some opportunities, and what are the things that we just have had a negative impact that we just need to work on. So I think if we can really hold on to those positive things and take them forward, I think there's it's a good future going forward. But looking out for the most vulnerable in our society, recovery is really important. That's just my final thoughts, but I think it's been covered really well by the rest of the panel.
Thank you. I think it has. I think just going back to the beginning and learnings, there was no agenda, there was no plan. We all got thrust into this, over almost the space of a weekend, really. We saw it building up in the media from sort of January onwards, and then all of a sudden, boom, and then the community support hub came along, and all the stuff that went around that as well, the immediate needs. And it's been amazing, seeing it from our perspective. And I guess, from the trust, we do see a sort of helicopter view, really, of just the sheer focus and just the ability of people to get stuck in, whether they're professionally doing it within the organisation, many of whom we've got represented here today in the audience, or certainly on the panel, or certainly the volunteer community, which was, took us back to 1940s levels of engagement, I think, indeed, didn't it? So thank you, Matt. So my final question then, this is a 30 seconds answer for all of you before we sort of wrap up this morning, because I think we're sort of getting close to the end of our time this morning, is where do you see us being in 12 months' time? So I'm going to go around like the screen in the order I see you here. So sorry, Grace, for your top left here. So where do you see us being in 12 months' time? Just reflecting perhaps on Kelvin's beginning, middle and end thing as well. Will we be at the end, or maybe just the beginning of the end, or the end of the beginning?
I have honestly no idea. I wish I could say that I knew, but I don't. But what I do know is we've coped with the last 12 months, so we can do it again. It's fine. We can keep going. We'll keep going. We're strong.
Yeah, we are. Absolutely. I agree with that totally. Thank you very much. Laura?
I think similar to Grace, we've been very reactive this entire year as we've been reacting to things happening to us. I think, we as an organization are starting to try to pull ourselves back and be more proactive with actions that we take and proactive with decisions. But where we'll be in 12 months time is sort of, it still seems a little bit fictional. I'm still, just coming out of that reactive stage, I think. I'm not quite, but I think that same with what Grace has said. It's amazing where we would have never imagined, 18 months ago that we would have been capable of doing what we did. So I'm excited. I think that opens this, Pandora's box of possibilities. So, I think it's an exciting time. In 12 months' time, it would be amazing to reflect on where we went, as a response to this.
Let's make a commitment today to say we do that then in 12 months' time. Thank you very much, Laura. Vicky, from your perspective.
You've asked the $1 million question there, Chris, haven't you?
Oh, I know.
If we all had a crystal ball, I definitely would have been stocking up on PPE and masks 18 months ago and probably be driving a yacht somewhere in the middle of a sea. I literally have no idea. But I suppose the one thing that I do know, much as the others have said and touched on, is that we've been so resilient up to this point. And actually, with kind of the right messages and the right direction, I think, it's kind of unended what people can achieve when they all pull together, be that from a personal level or a kind of organisational level. So I feel very positive about what we can achieve. I mean, I'm hoping it's the end. Not sure I could cope with homeschooling again. I think that's one thing I do know. But yeah, I'm positive, but I have absolutely no idea, Chris.
Very fair answer. I wasn't expecting
for once in my life.
Yeah, indeed, not at all. Yeah, and Matt, your 30 seconds.
Yeah, public health is always a pessimist in the room, I think. But no, I am actually quite optimistic in 12 months' time. I think, the winter might be challenging, but by the time we get to that period, I do think we will be living with COVID, as Kelvin outlined. I think we'll have a clearer idea in terms of what that will look like, effectiveness of the vaccines. I'm optimistic that by that point, I think we'll be in a much better place. And I think we'll have a clearer idea in terms of what the impact has been on the pandemic, and we'll have clear plans, hopefully, in terms of how we collectively across West Berkshire can help address some of these issues that have come about over the last 12 to 15 months or so.
Thank you, Matt. And Heather, last but not least, your final word, your 30 seconds of where you expect to be this time next year.
Oh, I think I completely agree with what the others have said, but I feel positive that we've got such amazing people in our community that the key is to reflect and learn on the things that have gone well and to ensure that carries on. And I think that that's what we'll do, that those things that have come out of it that are good will continue. And the benefit of the pandemic has been to highlight those inequalities and how to address them, and that's what we're here to do. So I'm positive that those positive actions will continue.
Very good final words on that. Thank you, Heather. And I think you're absolutely right. And actually, if I'd asked the question without a pandemic here, where do we expect to be this time next year? I think we'd all probably struggle to say. And that's life itself, isn't it? We never quite know what sort of rich tapestry and journey or odyssey that life's going to take us on. But I think what you're saying there is that what people have done as this group here and everybody around West Berkshire and North Hampshire that obviously we support here at the Trust, has stepped up in an amazing way. And I think that sets us really well for the future, really, in terms of what we may face. And it is uncertain. It's always uncertain. So let's not get too down about that. And I'm sure we'll face it with the same sort of determination we've faced the last 12 months as well. So I'd like to say thank you all to the panel this morning for interacting so well. It actually worked way better than I thought as well, actually. It's the first time I've done a sort of live session like this. We've always done these set pieces before. So thank you very much for getting involved this morning. I'd like to say thank you to the audience as well for engaging with us this morning. I hope you found it useful. The session has been recorded, so if you'd like to pass it on to friends or colleagues who may not have seen it, then they can watch it at their leisure. So a big thank you to the panel, also to Marina and to Louise in the background. This, of course, as an event, is partly to promote the Surviving to Thriving Fund that we launched earlier this year with West Berkshire Council, which is looking at supporting organisations who need some help as we come out of the pandemic. So there's £210,000 total raised in that fund between the council, ourselves and other charitable trusts locally. We are looking to raise more money into that because, as we said this morning, we do see mental health being an ongoing thing. It's right up the agenda. So, through the Good Exchange, and we're enabling that through the Trust. And you can, as an organisation, if you've got a mental health project, you can make an application via the Good Exchange, which will be heard by the panel. Some of the panel members are online this morning. So thank you again for engaging this morning. What this has said to me really is that, and I didn't quite know how it would go, and I've done lots of these community forums, but the information you get from this sort of session is second to none really. And whether we do it in small groups or we do it in public forum, we'll give some thought to how we do that. So again, we've slightly gone over time. It's lovely and warm out there. And shall we, perhaps some of you all go out, be kind to yourselves, go and grab a cup of tea or a cup of a glass of water or something and a biscuit. Go and sit outside in the sun for 5 to 10 minutes, if you can. Reflect and think about what we've achieved over the last 12 months. And I look forward to talking to you again in another community forum in the future. Thanks again to everybody for getting involved. And goodbye.
Thank you for having me.
Not at all.
Having me.
Very much.